I'm Carole Osborne, and I am the author of Pre and Perinatal Massage Therapy, which means I've spent a lot of time with my clients laying on their sides for massage therapy sessions. However, what I want to focus on today is not so much about how to modify for pregnancy, but for giving you some ideas about how you might work on backs and arms with your clients, whether they be pregnant, whether they be older clients who have some postural deviations that need accommodation, or perhaps some medical devices that need some accommodation for them, or perhaps even another group of people that I use sidelying positioning for are my overweight clients or clients who have some difficulty with breathing. So I just want to give you some ideas. You might want to start off doing some rhythmic rocking movement like I just did. Those kinds of slow and small amplitude rocking movements, they tend to have a relaxing effect on our clients, and they also help me to identify areas of restriction and taking advantage of the sidelying position. I can move spines and pectoral girdles and pelvic girdles in ways that I can't when I'm working in supine or prone, because there's less of the table to stop that movement. So these passive movements can be really wonderfully effective. It gives us an opportunity to identify, for example, that Molly here has tension in her trapezius and her levator scapula, like 99.9% of the rest of us do. And I can use this wonderful position to lower her shoulder away from her ear and give some length to these muscles as I wait for tissue release, as I wait for fascial response and lengthening and softening to happen here. After some deep tissue work, perhaps here in the upper back area or perhaps through the erector spinae, or perhaps I might like to do some myofascial work along the lateral side of the body, then this is a time you might try using some of your common Swedish massage techniques, and that would be applying your lubricant, whether it be a lotion or an oil. And as you work here, the same kinds of techniques that you might use with your clients were you to have her in the prone position will work sidelying as well. So we can use kneading strokes. So you can try out kneading strokes. I tend to work on mostly the ceiling side of the body first, but there's many times where you can get on the table side as well. So our kneading strokes work really well, and notice how wonderfully we can combine kneading strokes around areas like the scapula that are so accessible to us with both movement as well as with our long gliding strokes. Cross fiber friction, of course, is another way to work with these tight areas, and this position lends itself to cross fiber friction and searching for trigger points with long gliding strokes and bone cleaning types of strokes as well, followed by those lovely effleurages we all like to do. Now you may have noticed as I've been doing this work, I've been stabilizing Molly on the table. Sometimes I'm stabilizing by a hand here on her ilium or on her rib cage, but I don't have to do an awful lot of that because this sidelying positioning system provides some firm yet cradling support for her when I use it properly here to get that kind of support happening. And I can take this same idea down to the pelvic girdle as well. When we move to working with the arms, I usually like to bring the arms. I love to do things that mobilize this pectoral girdle. Again, using the possibilities of motion that the side-lying position gives me. You see me stabilize her hand a little bit more here. And if I'm going to do some circulatory work on her arm, I tend to like to do it with the arms stacked along the torso here. And I'm providing a little bit of counter pull onto the hand here so that as my strokes go towards her heart, I'm keeping a little bit of a pull so that her shoulder doesn't ride up against her ear here, and it stabilizes her arm on her side. I've experimented a lot because I use, as I say, I use this position not just with my pregnant clients, but with others as well. And I've experimented a lot with working from the front side of the table for the arms, and it doesn't tend to be the most conducive in terms of stability of the client on the table. So that's a little suggestion of some ways in which you might be able to work with your clients in the side-lying position. Just some general massage techniques. And what I suggest you do is you go out soon to your practice and put one of your clients in the side-lying position and experiment. And I think you're going to find a whole new perspective on how you can work and the possibilities for effectiveness with your clients as well. Thank you.